Hey everyone, welcome to the another episode of the Next in Time podcast. I'm your host, ST, and today our guest is Dr. Patricia Marsh, who is the founder and CEO of Ask Me or MD. And basically what it is an innovative telepractice that improves patient satisfaction and quality measures by educating and advocating on behalf of patients. And she's looking to make a massive impact in the health space by breaking down barriers that prevents patients from directly speaking with their doctor and understanding their health information. So Patricia, welcome to the show.
Thank you. Thank you.
I'm glad you're able to come in and being able to, break down barriers.
Yes, yes. I mean, how often are you experiencing something like that where you're trying to reach out to your doctor and you just can't?
Yeah. It's just, I don't know, talking to my doctor. I was like, okay, I got to set up 100 different appointments, fill out forms. I went to the dentist yesterday and, it took me just 1 hour to just be in the waiting line, fill out those forms. And by the time I get to the dentist, I was like, okay, I'm just like done, mentally done.
Yes. I feel the same way, especially when it comes to dentistry. But it's a lot more streamlined than when you get into the medical field. I think what the difference is their insurance system isn't a huge deterrent in how you practice dentistry. But in medicine, oh my goodness, the insurance company kind of dictates even our practice as physicians, like
Yeah.
what they'll pay for, what they won't pay for, where the patient can go, who they'll pay versus who is outside of their network. And I'm like, okay, we do not need gangs in the medical industry.
We just don't need so many different, you should not make a system much more complicated than what it is.
That's exactly right. It all boils down to the patient and the physician. Those are, to me, the essential ingredients of the healthcare industry. As long as there's someone that can help guide the patient with their medical issue, that's all that's necessary.
Yeah.
It just became more complicated because, unfortunately, we as physicians didn't kind of foresee the evolution of all of the impact of giving them so much power, them being the insurance companies and third payers, of how medicine evolves in the future. And so I'm just trying to help us as doctors navigate that space and give the patient care back to the patients, because they're the ones who need it most. They're the
Right.
ones who need to speak directly to us. And this was actually informed by a real life experience on the other side of medicine. So when I say that, as a physician, being on the other side of medicine is like, you're not the doctor anymore. You are like either the patient, or in my case, I was the daughter of the patient. And so seeing my father hospitalized for the first time
What
was
was that?
very unsettling. It was in April of 2018. I will never forget this. And I was just like baffled at the experience that we were having. I'm just looking around like, where is the doctor? And the doctor never came. Like, he had a straight up emergency. I asked the nurse
Dang.
to call the doctor 3 times. The doctor never came. And I mean, I understand it was like so early in the morning.
Yeah.
But at the same time, as a physician, you have the obligation of ensuring your patient's safety and that their health outcome is a positive one. So when I had to take the reins and advocate on behalf of my dad and get the physicians in to take care of him,
Right.
that's when my entire life switched. I was like, you know what? This is a huge problem. This
Right.
happens more than just my dad. I need to create a solution that would put the hands of advocacy between the doctor and the patient. They don't have to call the nurse. They don't have to call someone else.
Oh yeah,
It's
those
right
things just get, when you're trying to deal with an emergency, you want to get straight to the doctor. You don't want to get straight to like the physician's assistant or the second assistant or the third assistant, because I can tell they kind of make, like as I mentioned earlier, it makes the whole process that more like complicated than what it is supposed to be.
Exactly. And so I called the head doctor, like directly from my cell phone on behalf of my father. And I knew that I could do more with that, just that simple advocacy of reaching out on behalf of a patient so that they get the care that they need. That is what breaking down barriers is all about. And that's what Ask Me Your MD is all about. And
Yeah.
we made the solution extremely simple. We made a telechat platform. So you just chat with the doctor on demand. There are no wait times on the phone. It's just right there. We're right there waiting for you 24/7 so that you have that access to
Makes
supplement
sense.
your Google search.
Yeah. So before I go into your company, like I just want to get to know more about Patricia. Like how have you managed to become a physician from like when you grew up to how you become a physician in general?
The interesting thing is, as I looked back over my life when transitioning into entrepreneurship, I found that this is in my DNA. So when I was 9 months old, my mother passed away in a car accident. She was
Wow.
killed by a drunk driver. And I never knew anything about her. My dad, it was a very sore subject. He didn't like to talk about it. And from the earliest ages, like 3, 4 years old, I just remember my father educating me and my other three siblings just about life, like how to write a check, how to buy stock, how to buy a house, and algebra, and of course, their like homework. And I was soaking all of this in. I'm the youngest of four. And it
You know,
really formed. I'm sorry.
and I was just saying, when you're the youngest child, I think there's a saying that the youngest child is always the most intelligent one out of the children. Is that
Yeah, you learn everything. You learn from their mistakes, you learn from the lessons that they're being taught. And you know what not to do. And then they clue you in, like, or at least my siblings did. Like when you go to college, don't take this class and this class together. Like, things like that.
yeah.
And that was even in grade school. I remember because my sister and I are only 13 months apart. We're Irish twins there. And so she would tell me about the teachers that I was to have, and it was the best. It was like an internal review, and I would just like ace the test, because she prepared me. But going back to like who I am and how I ended up here, I wanted to be a teacher first because I was just so impressed by all of the knowledge my dad kind of gave us at that point in time. And it wasn't until high school when I began to like excel in science. Well, even before then.
And where
It
did you grow up?
I grew up College Park, Georgia,
Oh,
so
cool.
south of Atlanta, right by the airport.
You get to experience the busiest airport
Yeah,
every day.
exactly. Planes flying all the time above us. But actually I remember exactly the time that like my ambitions begin to change, and that was in the third grade. High school was when it was like, for sure, you're going to be a doctor. And I'll talk a little bit about that. But in the third grade, it was Black History Month, and Miss Anderson at Love T. Nolan was telling us about George Washington Carver. And I was like, there's no way this man made all of these different things with a peanut. Like, that was so impressive to me. And so for the first time, I wanted to innovate. I wanted to be an inventor. I wanted to make something that people utilized on a mass scale. And so the very next year in fourth grade, when I got my period, I asked my stepmom for $200 to get a patent. And I don't know about, parenting, but when a 10-year-old kid comes up to you and is like, I'm going to need $200 for my patent, I'm going to make these pre-patent underwear, it probably sounded bogus and crazy, but that was one of the earlier memories that I can like pull from and be like, oh, wow, you always had this in you.
Right.
You always wanted to create and innovate. The science piece came like middle school, high school. Definitely it was solidified in high school with just the acceleration within science. I had a published article. I like had a national presentation in San Diego about the first year that I did research, and I was just looking at osteoporosis, but it
Like you
was,
were very curious in what you're
yes,
in everything. You were like,
yes,
how should I learn this? What should I like? Not like how, but like why do I feel like I really want to learn this?
exactly. I was absolutely curious. But it was always in the efforts and objective of creating something to help someone else. And so when I told my dad that I wanted to be a doctor, he was like, oh, your mom was a nurse. And I'm like, this whole time, my mom was a nurse, and he
You
gave
got,
me her stethoscope, her medical dictionary. Yeah, it was wild.
basically you basically got all the medical related traits from your mother.
Exactly. And that's what I came to find out. My dad, he's the software engineer. He's like the tinker, the inventor, the kind of like, let's figure it out. And so I got that part from him. And then, of course, now I'm in health tech. I'm like, oh, this is just my parents together. Yeah.
Yeah.
Yeah. That's how I got here.
So
Absolutely.
and then now because of that experience with your dad that you saw the like the trauma that you had to deal with in terms of like making sure you get the doctors available. That gave you that spark and the idea of I want to create this telepractice where I just don't want to deal with any of the other don't want to deal with the paperwork, don't want to deal with the second or third nurses in the way. I just want to go straight to the doctor. So in the way you're trying to build this, like tell me about like in what way are you looking to build this? I mean, you've already explained earlier, you said you're building a telechat, but in terms of what aspect are you building?
Right. And help me to understand what you mean by aspects.
Like are you looking to service like a wider audience or
Yes, yes. So, my co-founder, sorry, I'm co-founder of Ask Me Your MD. My co-founder, Dr. Sirit Mission, we met in residency, where we were both training to become specialized. I was going to be a specialized family medicine physician, and she was internal medicine.
yeah,
And we had this synergy from day one. And we found out on rotation together in the ICU that the way in which we spoke to patients and had objectives of helping them to truly understand what was going on, we really connected on that. And we never lost that. And we would often tell each other stories of like, our patient care experience, basically, of rendering, medicine, like practicing medicine. And so she always wanted to increase just the simplicity of accessing physicians and wanted to make the world's best doctor chat. And I was
yeah,
like, oh, okay, that's excellent. I think we should place this doctor chat in hospitals and in clinics so that patients from both areas would be able to access the physicians, because in both areas, the doctors are overwhelmed. They don't have capacity to answer in a well enough time that is in time with the patient's problem. And so we knew that from working in both of those settings, one extra thing for them is just not possible. we would have to recruit another group of physicians that this is all we do. And we
So,
wanted to do it in those two settings at first.
so
Yeah.
just before I go further into your business, do you feel like maybe it's because of COVID that's like kind of was it a second trigger where you've seen a lot of hospitalizations happening left and right? And let's say people who are dying from other causes, they couldn't get the access, the proper treatment because of something going on. Because let's say because a lot of doctors were too busy taking care of COVID patients. Do you feel that's
Right.
also another catalyst as to why you decided to build this?
Oh my goodness. Yes, yes. So we have evidence, and there have been multiple publications showing the worsening of other chronic diseases because of the pandemic and because the access to care was so overflooded with COVID patients that regular heart attacks, regular, surgical emergencies, appendicitis, and things like this worsened over that time. So we are, slowly making gains back to where we're able to get the patients that kind of got off track back on track. And then, of course, the innovation and push for telemedicine really helped us to get back there because our hospitals are still being overflooded, in the peaks and waves of COVID. Yeah.
Yeah.
And now the tridemic. So,
I think now there's like a million. I think tomorrow's there's going to be the quadrademic or the
you
quintademic.
know, and we're just waiting for, the evolution of another variant. Thank goodness we haven't seen it yet. We've just seen, kind of cousins of the Omicron, trying to make fancy new changes. But we have also changed as practitioners and knowing exactly what to do so that we won't lose so many people. Yeah.
And also currently, okay, so what you're building right now, what challenges do you see in terms of building, like in terms of like, getting this implemented across a wider spectrum?
So the biggest challenge is trying to integrate it into the technologies that already exist. So anytime you have a new piece of technology that you want people to adopt, it is very hard to just kind of interject yourself. So we wanted to, first of all, create a web-based service so that you could get it on your browser, on your mobile device. And then furthermore, we wanted to connect it to an electronic medical record so that we would have our physicians answering your questions and your concerns in real time, but in the context of who you are and what you're already dealing with. And so those are the challenges, integrating into systems that have already been built, and the fact that not every single hospital, not every single clinic uses the exact same system. So you have to have something that is very, interchangeable and interoperable easily. And that was the first go at it. Like, we definitely need to make this web-based so that people can just put it in their browser, askmeyourmd.com, and we're right there.
And so how many hospitals have you been integrating this into?
So just two thus far. We haven't completed the integration of the service and the platform, but we are constructing pilots to test that interconnection
Yep.
to make sure everything is secure, because there are laws to healthcare security and that
Like
documentation.
you got to deal with the HIPAA compliance, right?
There we go. I didn't want to throw out, like,
No. Okay, because
yeah,
when
yeah,
you're dealing with anything related to medicine, 24/7, you just got to look at the
yes.
HIPAA related stuff, and I'm like, yeah, that again.
Exactly. And so that's been a challenge. It's been a challenge because you'll find that a lot of practices, they protect their information because a lot of people are utilizing that data to profit.
Yeah.
And so when you don't have a mindset of it being patient-centered, your business model kind of becomes corporate, and it doesn't always translate well in hospitals and care settings. And
Yeah.
so that's something that I'm seeing a lot of, and I hope that trend doesn't continue. I hope one of us physicians or either a patient that's had extensive healthcare experience can inform these companies, like, your value base and your ad needs to be centered around who's receiving the care.
And
Yeah.
also, where do you see the like? Do you feel like it's more difficult to integrate this with hospitals, or do you feel like it's more difficult with, like, let's say, individual like clinics?
Oh, hospitals for sure. It's just the system is so much larger. Clinics, they have thousands and thousands of patients, but usually you're not, dealing with hundreds of patients at once, usually. These hospital systems have so many different departments running all at the same time. So an individual clinic is a little bit easier than a
Maybe,
hospital
maybe
system.
what like are you currently focused more on hospitals first or individual clinics?
Well, it's funny that you asked that. In the initial expansion of our services and who we're going after as a customer, those were the first two identified customers. But what has ended up happening is that enterprises, they have identified that they need added value benefits for their employees. So we met with Microsoft and had a talk with them, and we'll follow up with them next year. And then we had a talk with CVS, specifically their clinical trials services department. And so they have informed us that, oh, your customer base is a little bit broader. And a lot more people can utilize these services just because of access, affordability, and efficiency. So we're hitting
They always got to have the double AE.
flame. Yeah,
Double
yeah,
AE, yeah.
yeah,
It's like that's
exactly.
those acronyms are always necessary whenever whenever I realize, like, that's how I remember things much more
Love
easily,
our
just by
acronym.
creating just through acronyms. But
Yes,
and,
medicine loves their acronyms.
and also, why do you feel like, you know, do you why do you feel like this is necessary in the coming years, this overall vision of this like providing this telemedicine or like chat or something like that? Like, why do you feel like this is necessary?
Two reasons. The first is patient experience. Because the healthcare system is being overwhelmed, it is not going to be a good experience for a large portion of people. And that is because the system has been stressed. The nursing staff stress, administrative staff stress, us physicians have been stressed. And so, just like we saw, in other industries, you have to start to compartmentalize these roles. And so when you're trying to develop like innovation and saying, okay, what would a patient want most? It's like, okay, they want to talk to the doctor. That's why they make the appointment. And so we looked at, like, okay, how can we make that interaction fast, easy for them, efficient for them, give them the most out of that, while also looking to the physician. So Ask Me Your MD does not do the entirety of telemedicine, meaning we do not send prescriptions, we do not make orders, we do not do patient paperwork. And
Yeah.
that was intentional because we are looking at physician burnout and we're looking at patient burnout and
Yeah.
patient experience. And so we wanted to marry those two and come up with a solution that provided the most value and the best experience for the patient, because now we're availing ourselves to your schedule. We're saying, you reach out to us. Our job is to be here and to get you the information and resources that you need.
So
And yeah, and that's pretty much, those two aspects that we look forward to building off of and innovating within that physician burnout and that patient care experience.
and also, where do you see this going in the next couple of years in terms of like, okay, in terms of how much, in terms like your overall like targets for the next coming years? Like, do you feel like you're going to integrate this into many hospital systems, or what's the overall goal?
Yeah, so that was the first goal, is to integrate it into hospital systems. What we found was that it's a little bit more difficult with the ways decisions are made and purchasing suppliers are had within hospital systems. It's just, you have to have a lot of yeses. Where we're seeing a little bit more leeway is into the corporations that are established, that have specific needs that they've identified our company can actually do right now. And so the deal with CVS and becoming a diverse partner with CVS, they identified specifically, oh, we can utilize your telechat platform in order to have educational services for our patients. That was something that, it was down the line of, customers, much down the line of customers. But it became now our first full customer because they had a strategic need that we were able to meet. So where do I see this going? Oh my goodness. I would love for Ask Me Your MD to be a government mandated service for Medicare patients, because we know that when you have access to a physician, your health outcomes are better because you have somebody that's Google Live for you to say, oh, not that Band-Aid, that Band-Aid, not that medicine, that medicine, over the counter. And so you're able to mitigate some of these really bad outcomes for patients on their schedule. Again, I want people to know, Ask Me Your MD, we are available, live physicians available to answer those questions on your schedule. Yeah, it's just all about that. And so doing that at large, we do have a global, vision of having Ask Me Your MD in China and in South America and Africa and Europe, because we want other physicians to understand the value of availing themselves throughout the patient's journey and really have a patient-centered solution. So yeah, it's
Yeah, it
it's
makes sense.
pretty
And
crazy.
since we're running low on time, what would be your well, my final question is, what advice would you give to founders out there, particularly in the health space when they're trying to build something big?
Oh, I definitely would say, if you are not from the health space, truly inform yourself as to if your solution would work for those who are integral to the system. And we identified, and I stated, the two most essential pieces of the healthcare industry is the patient and is the physician. Now, others would say the insurance company, and that's true. But I think as we continue to evolve telemedicine services, people are looking for more specific solutions that fit them. And so you really want it to be patient-centered. You really want to make sure these are informed solutions with those who are within the healthcare industry. And then if you're just starting, just get ready to strap up for the ride. Like, this isn't something that you can do overnight. there are no overnight successes. Like,
Yeah,
it's for
as they say,
years.
it takes 10 years to become an overnight success.
Exactly. And so that's my advice. Definitely inform yourself. Be well informed about who you're targeting and how you're targeting it.
All right, cool. Patricia, thank you so much for coming on the Next in Time podcast. And I'm looking forward to seeing how this venture can become successful.
Thank you so much.